I'm Dr. Charles Emala. I'm a professor of anesthesiology at Columbia University in New York. Peer review process improved my manuscript by providing constructive suggestions to improve both the clarity of presentation and interpretation of my findings. I really felt that the experience was a partnership between the editors, the reviewers, and myself in trying to frame the context of my research findings in a way that was interesting and informative to the journal readership. It's important that I publish in anesthesiology because I feel that it is the highest impact journal in our specialty in the world. I view anesthesiology as really the flagship journal of our specialty. So to disseminate research information to the anesthesiology community, I feel that publishing in anesthesiology would have the highest impact and the highest dissemination of my research findings. So the journal Anesthesiology can continue to guide and influence the specialty in a positive way by publishing research findings that have the highest impact in the ultimate clinical care of our patients. As a basic scientist, I realize that it's always important to frame my research findings that the readership can understand both the transition and translation of my research findings to ultimate clinical care. And I feel like the editors and reviewers of the journal really facilitate that process by making suggestions to make sure that the readership understands the context of even the most basic research findings, how they may ultimately translate to better clinical care. Yes, I think all too often as basic scientists we fail to recognize that the readership of a clinical journal is interested in understanding the translational impact of the work that we do. So I think it's always important, for example, in the abstract and the introduction as well as the discussion, to make sure that it's clear to the readership that even the most basic findings could have potential future relevance to the specialty, and to frame those sections of the manuscript in a way that are most receptive to a broad audience that has broad clinical interests.